Well, great. So the way the night will go is we'll give our little PowerPoint presentation, which we haven't given before, so this will be fun. And then question and answers afterwards. So, all right. Shall we? Sure.
So, let's have a look. So the ITCC vision started about 1.5 years ago when the three of us were introduced. And we wanted to create an integrative model, so combining the best of conventional, naturopathic, homeopathic, neuro research, neurodevelopmental therapies in a holistic model that would emphasize sensitivity, loving relationships between the practitioner and the child. And then we wanted a team approach because, the whole concept is it takes a village to raise a child, and it's more than the sum of its individual parts when you create a synergy. So we were looking to create a synergy between our modalities. And then our philosophy is to honor the individuality and the uniqueness of each child, who we place squarely in the center of their own developmental journey. And then the challenges are, we see all kinds of children with all kinds of challenges. But certainly in my experience, challenges are the inverse of gifts, and gifted children, I'm also Montessori. I started off as a Montessori teacher. In my experience, gifted children always have challenges, and challenged children always have gifts, where they're kind of the inverse of each other. So I'll just have Dr. Merman, if you want to. Hi. Hi, Neely. Come on in. Find a seat.
Hey there.
Nice to see you. We're just beginning. So I'm going to have Dr. Merman stand up, and if you can just, either read your slide or introduce yourself, however you want to do it.
Hello, I'm a homeopath, I'm a medical doctor, homeopath, and I do the neurotransmitter work, and I'll be talking about it later. I'll explain those things.
So Dr. Merman's a really gifted homeopath.
Thank you.
Very gifted homeopath. And,
Challenged also.
Okay. Very honest and gifted homeopath. I'll have Dr. Litchi introduce yourself.
Yeah, I'm a naturopathic doctor. Naturopathic doctors were trained in conventional as well as more alternative ways of dealing with things. So what I do is the ground level physical work, helping people get over, identify allergies, gastrointestinal problems, functional medicine type stuff, helping balance the body so development can happen, get the challenges out of the way.
Thank you. And Dr. Litchi works here at the back page.
Yeah, this is my clinic. Yeah.
And then I'm a neurodevelopmental specialist. I moved to America from the UK over a decade ago, and I started off in education, both post-school education and Montessori education, and that led me to neurodevelopment because, in fact, Mary was in my 3rd grade class when I first moved here.
No, my daughter.
Yeah, her child was, her daughter, who's now in college. And so education led me to neurodevelopment because when I moved from the UK, London, I was, I was in inner city schools teaching large classes of 33 kids, only maybe two-parent children in the entire class, mostly single parent, maybe 8 out of the 33 would be second language users. And then I moved here to St. Louis Park to a private school, and this class of 33 kids who were so easy to manage, and I had these 18 two-parent, middle class children, and they were impossible, and I'd never heard of ADHD, all these terms, this was about 16 or 17 years ago, and I had to figure out quickly how they were learning, because 12 of them would go and take meds and, at break times. So that's how I got into the neurodevelopment piece and trying to understand the brain-body piece and how the brain learns in the classroom. So the integrative, our mission The Integrative Team for Children with Challenges provides treatment that addresses body, mind, and spirit within a synergistic, evidence-based model guided by a team of experienced professionals. We provide comprehensive integrative therapy for children with developmental, neurological, psychological, and other challenges. We address the underlying cause of imbalance, not labels. Our mission is to meet each child's need with a carefully individualized interdisciplinary treatment plan, drawing from our joint fields of expertise, which include medicine, homeopathy, naturopathy, childhood reflexes, and neurodevelopment.
Yeah, and I think we're trying to solve a problem that's out there of children with challenges and adults with challenges, and the lack of really integrative care. You know, that people have a provider here, a provider there, and they're not always communicating very well, and so the interface between conventional and the interface between alternative providers can be not good, and things can be missed. And so that's what we're trying to do, is provide a service where we can all communicate together and work on truly integrative care.
So, lots of our clients come in, I've tried therapist after therapist, or nothing was working, I'd given up, I was overwhelmed, I no longer thought anything could make a real difference. And that's why we thought there was a need for this integrative approach. So we have an 8-step program. Step 1 is an hour initial intake with the 3 of us here at Bhakti Wellness, where we just listen to the concerns and so on. We do paperwork, pre-testing data, parent surveys. Step 2 is the naturopathic consult with Dr. Litchi here, which is approximately 90-minute intake involving a detailed history, physical exam, treatment plan initial, and laboratory testing recommendations. Then step 3 is, and then the blood draw over at Life Medical, Dr. Merman's clinic. Then step 3 is a homeopathic or neuro research protocol intake with Dr. Merman, who's MD and homeopath.
And we decide which one at that initial intake, depends on the case.
Yeah. Then step 4 is a childhood reflex screening with me, where I identify, up to probably 36 different reflexes that, and then see the key ones that may be affecting the child's behavior. Step 5 is weekly reflex integration sessions with me, where I actually work on integrating the reflexes. And then step 6 is a month follow-up with Dr. Litchi, where he actually gets the results of the initial lab work. Step 7 is a month follow-up with Dr. Merman, where he sees if the treatment, how it's going, the homeopathy or otherwise. And then step 8, we do a 3-month post-eval and further planning. So that's the basic integrative approach. So the initial intake, we're here to listen, to give support to the families that come to us, and to really try to address all of the child's developmental needs at whatever level that is.
And basically answer questions from the families, because we're all presenting different therapies, which we're going to integrate, and we need the parents to be comfortable with how we're going to approach the case as a whole.
I think I was gone when you started yours, so you didn't do that one, but you can anytime. So then the treatment with Dr. Merman, it involves, and Dr. Merman will speak more to this when it comes to his piece of the presentation, but an initial 2 to 4 hour, I believe, consult.
Yeah, whatever it takes.
Right, whatever it takes. I mean, my son's been to him, and I must say it was just so therapeutic being listened to for that amount of time. I think we were there for 3-4 hours.
Probably.
And when we just talked. And he listened, and he's an excellent listener. And that alone is very, very therapeutic. So he listens to all the concerns, and then takes very, very detailed notes at any level. And then he determines the pattern, the disease pattern, the remedy to match it, taking every complaint into account, including physical health, emotional, mental, behavioral, social, spiritual, the whole child. Then, so it's an unlimited time limit until he's identified the correct remedy. Then he starts the child on a 1-month initial trial. This is if he's doing homeopathy of the remedy. And then, if he deems it appropriate, he will treat the child with the neuro research protocol, which he'll speak to that. So that's with Dr. Merman. Then the treatment with Dr. Litchi a detailed history, or going over development, lifestyle, current and previous symptoms, patterns, review of past medical history and records, a detailed physical exam where needed, lab tests, initial recommendations, including diet, supplementation, detox, lifestyle changes, and then after the lab results, he'll give more specific instructions. And then there are 3 follow-up office visits after the initial intake. So that's the basic program. And then with me, I do the reflex screening, where I assess the level of integration of approximately 30 childhood reflexes, identify key ones, and the neurodevelopmental systems that may be impacting the child's behavior, such as all the sensory systems, tactile, proprioception, vestibular, the muscle tone, and then auditory, visual, the laterality, the anterior hemispheric, kind of similar to occupational therapy in a way, but more holistic. It's more of a holistic model. Then the reflexes form part of the genetic code, and then I use the special technique, which I was trained by Dr. Svetlana Maskutova from Russia. It's her school of reflex integration that I use, and to fire the neurological processes that can enhance greater sensory and motor function. So, like the reflexes that I work with are a little more complex than the simple kind of knee-jerk reflex, the patellar reflex, which is, just basically goes to the spinal cord. But the reflexes that I work with go, process through 5 levels of the brain, so spinal cord, medulla, midbrain, basal ganglia, and cerebral cortex. So a lot more complex. And because of the multi-layered workings of these neuron networks, integrated reflex can improve the child's functioning physically, emotionally, cognitively, and behaviorally. And then we have a home program. So, the parent's a key member of the team, and they're expected to administer the homeopathic remedies, make sure the child is taking those daily with consistency, follow through on the naturopathic lifestyle changes, and then I give them daily exercises that they do for the sensory piece and the motor piece. And then if there are any challenges for the parent, we support them. So if it's too much or the parent's overwhelmed or it's not working, then we try and help. It's not like, oh, you have to do this, and we're there to support the parent through. So now we'll talk about the theory behind our work. I'll start, and then we'll go to Dr. Merman and then Dr. Litchi. So the neurodevelopmental approach that I take, Sechenov was a great Russian physiologist, and in 1863 he said, all acts of life, conscious and unconscious, originate in reflexes. And if you really take that statement in, it's very, very profound. Because if all acts of life originate in reflexes, then you could probably address all conditions of life, with a piece of it would be through reflexes. So this is the ATNR reflex in a little client. So the definition of a reflex, can I have my glasses, please? Thank you. In one of my classes, we all had to write a definition. So this is the one I wrote. A reflex is a nervous system reaction caused by a sensory stimulation of the skin, tendons, muscles, pupils, or ear membranes. It's an automatic, often unconscious response by the brain that activates a movement or posture and is designed to trigger a fight, flight, or freeze response. Dynamic reflexes end in a continuing movement and are activated through the sympathetic nervous system in order to arouse. Postural reflexes end in a static posture activated through the parasympathetic nervous system in order to calm down and inhibit. A reflex is a genetically encoded survival response that is hardwired for our self-protection. So in today's world, what's the key thing that everyone's dealing with is probably, what would you say the key thing underlying everything else that we're all dealing with? Probably stress, right? Stress. Or else stress, we can't say it. Yeah, probably stress, So when we're working with the reflex level of things, we're working with that nervous system, and we're working with stress, and we're removing some of those stressors that are interfering with functioning at many levels. So the neurophysiology of a reflex is a genetic pattern of physiological function created by nature as a code and a structure ensuring neurosensory motor development. Working with reflexes, you touch the underlying net, a net that serves like the infrastructure of a leaf or a building. A reflex is the informational unit for positive survival and gradual physical, emotional, and cognitive development. So when I'm working, that's Dr. Muskova's definition. So when I'm working with the clientele that I see, and I don't just see pediatric, I see up to adults, I see adults too. The main thing that I'm looking to do before I even, want to integrate this reflex or that reflex or the other reflex is work with that survival brain, that brain stem, and release, what we term as the negative protection. I think that's the gift of this particular approach to reflex integration, is working with negative protection and bringing the system into positive protection. So working with the survival systems and supporting them so they can let go and move into growth and development. Reflexes emerge at 9 to 13 weeks in utero, and these are slides from actual, I've got the tape of this, the ultrasound where the baby's moving. So the 13-week unborn baby in that first slide, when you see, I won't play it because it's too long, but they're activating the leg cross flexion extension reflex at 13 weeks. And then the trunk extension reflex, also 13 weeks. This is this reflex like this. And then this is a little later on at 36 weeks where you see the eye tracking. So we already have, eye tracking at 36 weeks. Sorry, I think that's mine. Is that here? Turn it off. Sorry about that. But I had turned that off. So, how many of you have seen this slide or know about this? Okay, yeah. It's a 21-week-old unborn, Samuel Alexander, being operated on by Dr. Joseph Brunner. The baby was diagnosed with spina bifida and would not survive if removed from his mother's womb. So Dr. Brunner performs surgery while Samuel is still in utero. And during the procedure, he removes the uterus via C-section and makes a small incision to operate on the little baby. And as Dr. Brunner completes the surgery, the little hand comes out with the grasp reflex and grabs the surgeon's finger firmly. And the baby was born in perfect health. The operation was 100% successful. The surgeon is still recovering. But, it just shows the strength of those early reflexes. So reflexes and synaptogenesis, and this is where this work is really profound. Because we're born, with these billions of neurons which form networks of synaptic connections as we experience movement and sensory input. And this is a representation of the density of the connections, which slows significantly after the toddler years, But muscle movement patterns, such as reflex integration patterns, create more and more synaptic connections. So when we work with very severe challenges, I do camps around the country, and some of the children we see are very, very severe, severe cerebral palsy, severe brain damage. And the key is myelination. So this work, when you're working with the reflexes and the way we work with them, you're creating myelination, you're creating pathways. And we get profound, very, very profound results because of that. Results like cortical blindness where the vision starts switching on, or children in wheelchairs, begin to learn to walk and so on. So the 100 billion neurons with the 10,000 synapses, when you're working with the brain, there's just really no limit to the potential. If you can speak to the brain in its own language, and the reflexes are the code of the brainstem. So you're actually working with its own code, and that's why it clicks. So reflexes are the basis for brain development. They reach 5 levels of the brain, we mentioned that. They're the basis for the regulation of the body's fight-flight response, so stress. They work on the hormonal, the immune, the sensory, the motor, and other levels. They're the basis for sensory motor integration. They're the basis for gross and fine motor coordination, basis for emotional control, and they're the neurophysiological platform in which future skill and performance is built. So what does reflex integration look like? This is at one of the camps. So here I'm working on a little girl, and I'm working on I work with 8 key protocols, and this is one of the protocols called neurostructure, and I'm working with all of her systems. The work does take place on a massage table for the most part, and It may look like massage, but it's not massage. Certain aspects of it may look like massage. I use Montessori principles to follow the child through, and then I apply the rigorous techniques and theoretical concepts of Dr. Mesketova. And then I bring in other tools like the rhythmic movement piece or brain gym or handle where needed. So I work with the reflexes of the three anatomical planes, the sagittal reflexes, which are laterality, left, right, and these probably relate more to academics, reading, writing, dyslexias, dysgraphias, all those issues, as well as other issues too. These are the transverse reflexes, up and down, and a lot of these reflexes relate to emotional control. So kids on the autism spectrum, certain of these reflexes are huge for them. Hand supporting reflex can be life-changing. That's a reflex where you fall and the hands support so your head doesn't get hit. And this reflex is huge for boundaries. So the bully and the victim relationship, both of them need this reflex, and it works on the emotional plane too. And then reflexes of the dorsal plane, front, back, and these reflexes, a lot of them relate to focus, ADHDs, and so forth. STNR reflex, there's Dr. Miriam Bender, she has an achievement center on the East Coast. She says the cause of ADHD is this one reflex. She's got a book on it. I don't agree with that, but I think it's probably a little more complex than that one reflex, but I thought it was amazing that she would, say that. And this reflex is very, very key with ADHD. So the key protocols that I work with, archetype movements, they're the early movements out of which the reflexes come. So they're archetypes such as core flexion, core extension, without which you can't have the reflex pattern, for example, Moro reflex. I work with the tactile reflex integration program, which works on the tactile 8 to 11 tactile neuroreceptors in the skin, and all the different receptors like the Golgi and the there's a whole bunch of receptors I work with there for cold, for heat, for pressure, like deep pressure, light pressure, etc. Hair reflexes, and then neurostructural reflex integration, which works on the core and the core tenon guard, which is the core of the fight-flight schema. The actual reflexes themselves, such as grasp reflex that we saw, the ATNR reflex, the Moro reflex, the startle, the fear paralysis reflex, and then the orofacial work, speech, language development, feeding issues, working with all these facial reflexes, both inside or intraoral and this whole area, the occiput, the neck, and so on. The auditory visual reflexes, the acoustic reflex, the breathing reflexes for the breathing system, and the birthing reflexes. So those are the key reflex protocols that I work with. It's quite profound, quite complex, but quite simple at the same time. And so that's me. That's the reflex work, and I will move and let Dr. Merman take over. Thank you. And we'll take questions and answers at the end. And then you can
How do you work this thing? Okay. So I'll first talk a little bit about homeopathy and then about the neurotransmitter stuff. So for homeopathy, this book right here, I wrote it to explain the system. You can buy it for $8, or it's all online on this website right here for free. So you can read it right there. Yeah, that's the website, bookonhealing.com. If we consider how we work in conventional medicine, and I'm an MD, so I work the same way when I see people the normal way. I look at the body and I see a big chemical reaction. And so my job is to figure out what's off as far as chemistry, possibly mechanics, possibly electricity, and then we address it by manipulating those systems accordingly. Either we give medications, sometimes we do surgery, sometimes we do physical therapy, etc. So this is kind of like that chemical physical plant of the body. From homeopathic perspective, we think, yes, this exists and it works, but it's driven by something from within. We call it the vital force. And we think this vital force actually maintains the physical plant, all the chemistry, all the electricity and mechanics in harmony. So in order to have the body working well, it has to be the vital force that's driving this body, that's making it alive, has to be in good balance. So my way of explaining it, it's a little bit like in the computer. There's hardware and there's this operating system. And so when the computer doesn't work, you bring it to a technician. They have to figure out if the hard drive is a problem or something else, or there's a bug in the operating system. So homeopathy is a little bit like debugging the operating system. Okay, that's how I see it anyway. It was discovered or invented by Dr. Hahnemann. That's a monument to him in Washington, D.C. It's the only monument to a doctor in Washington, D.C. It was dedicated by President McKinley. This was very big in 1900s and the beginning of the 20th century, and in 1800s. Then later AMA came about and homeopathy was suppressed for a while. Now it's seeing some resurgence in the last few years. With homeopathic remedies, we treat just basically everything that's reversible. So be it chronic disease, acute disease, infections, influenza, for example, responds quite well to homeopathy. Right now, we have a group working on trying to implement it in Africa for Ebola treatment. We think it's going to work quite well. We've seen some initial, positive effect from it, but we don't have much experience. It's been very effective in many epidemics. For example, in 1918 pandemic of flu, where about 50 to 100 million people died. There's an article which is on one of my websites, which is a report from the field from that time. It turns out homeopathic physicians who were treating these people with influenza at that time really were not losing too many patients. They lost somewhere around 1 to 4%, depending on who was reporting, where conventional doctors were losing about 30 to 35% of their cases. So very powerful. And the way we apply homeopathy is we, as Suzanne was saying, we take a really very kind of all-enveloping case where we take into account everything about the person, whether it's a child or an adult, and prescribe a single homeopathic remedy to fit the whole case. So we are looking for an essence in the case that corresponds to an essence or of a particular remedy. And if a child has, let's say, an asthma and ADD or depression or eczema or stomach aches or whatever it is, in the end, this single remedy should actually debug their operating system and enable the body to actually heal itself. Okay, so now for the other system that we're applying as far as this program is concerned. The neurotransmitter deficiency disorder, so-called. Don't quite like the name, but that's what Dr. Hinz, who developed it, actually called it. And it has to do with any condition that has to do chemically. Now, at this point, we're dealing with the hardware. We're dealing with the chemistry. So chemically, there's some imbalance of dopamine and serotonin in the body. Therefore, there will be symptoms relating to that imbalance. So any disease that has to do with those neurotransmitters will be treatable by this system. And there's a very short list on the screen here. It's any mood disorders, fibromyalgia, migraines, overeating, hunger. Too much hunger is a symptom. Some gut disorders, etc. So this is about the function of nervous system, and there's a little article here I wrote about this approach. Let me see what's down in there. So basically, the nervous system as a whole is like internet. It's made up of these nerve cells called neurons, and they talk to each other like computers, exactly like internet. So the information is generated in the neuron, and then it sends out to other cells. And Suzanne was just saying there's about 100 billion neurons out there. And the weak link in this system is where the transmission from cell to cell takes place. This spot is called synapse, where one cell, the signal arrives here electrically. There's a little bulge here, and from here it needs to be, this is a presynaptic cell, that is a cell before the synapse. This is the synapse, or synaptic cleft between the cells, and this is the receiving cell. So when we have information coming here, it's transmitted across this gap by so-called neurotransmitters or chemical molecules, which are secreted from here, diffuse across the synaptic cleft, and attached to these receptors on the other side. And receptors are like doors that are opened by these keys, which are the neurotransmitters. So when enough of the doors are open, the information is transmitted. If the doors don't open so well, the locks are rusty, then we have a problem with transmission. Then we start getting symptoms. So once the information is transmitted here, the presynaptic cell, because the body doesn't want to waste anything, takes back all the unused neurotransmitter molecules from the synaptic cleft. We know that if this system doesn't work so well, we can actually make it work better by increasing the amount of neurotransmitter here in the synaptic cleft. There's a couple of ways of doing it. One way is medications. And these are medications that have to do with neurotransmitters. Basically, you block recycling. So all the medications that block recycling are called reuptake inhibitors. So some of them block serotonin, so they are serotonin selective reuptake inhibitors, or SSRIs. Some of them norepinephrine selective, etc. Some are dual, block everything. So you can see some of these are antidepressants, or mostly used as antidepressants. Some are appetite suppressants. Okay, they work the same way. Some are the ADD drugs. These two are not quite legal, but do the same thing. Cocaine is actually a triple reuptake inhibitor. So basically the same idea. So the other way of doing this to increase the amount of neurotransmitter in the synaptic gap is to actually give the cell more building blocks so it can actually produce more neurotransmitters. And that's what we're doing with these supplements that are part of this neurotransmitter protocol that developed by Dr. Hinz. So we give 5-HTP, which is a precursor for serotonin, and tyrosine, which is a precursor for dopamine and norepinephrine. Build up the levels. The system starts working better. You really don't need to block anything at that point. So it works better than medications. It works on the same system, basically the same idea. Works better. It doesn't stop working because medicine, when it works, will actually deplete the presynaptic cell because it stops recycling. So, the cell is still putting out neurotransmitters, but it's not taking them back, so there's going to be less inside. So with this system, we're avoiding that issue. So we can use it for a long time. Unlimited, basically. I got very interested in this system in about '98 when I actually got a mail from Dr. Hinz. And I usually don't read those kind of things, but for whatever reason I decided to at that time. It said, come to the seminar, I will show you the best diet program. So I didn't believe it, so I actually called him up. He said, well, if you don't like it, I'll refund your money. So I looked into it a little bit. It made some sense. I actually went to the seminar. And at that point, I had a big issue. I was a glutton, and I, was hungry all the time, and had to control my appetite by whatever other was stressful. So I actually started taking the supplements myself, and my appetite went down. I was able to comfortably lose the weight and keep it down. So I'm still taking it. So since '98 on the system. I'm probably the longest running case in the world, I suspect. It's usually done by licensed docs because Dr. Hinz doesn't allow anybody else to get the supplements. He wants us to make sure that we understand the system, understand how to deal with other medications the patient may be on, etc., etc., etc. In kids, when I'm deciding which system to use, neurotransmitters works quite well, but it's not a cure, right? So still, we can overwhelm the resistance of those receptors and make the system work. But in the end, we haven't cured the problem because the receptors are still resistant. So whenever I can, I prefer to do homeopathy because that is actually a more curative system. Even though it's much more difficult for me to do, it's much slower in its effect, but it's more permanent and in the long run better. Okay, neurotransmitter system usually faster acting, and it's quite okay to continue using it for a very long time. And I've actually had some kids who have been on this for ADD or behavioral issues or whatever and doing quite well. And I keep telling their parents, look, let's just try to cure them now. Let's do homeopathy and get them off the supplements. But they're so much better, the parents are not interested. Okay. It's better than the drugs. So let's see what we have here. Andrew, you are.
Okay.
I can sit over there then.
All right. So naturopathic medicine and my role in this team is primarily identifying and removing obstacles to healing. When there's inflammation problems in the body, it's difficult for people to get past that. And so that's mainly what I do, is help find the blocks to cure. Do this with healthy lifestyle, nutrition, activity, sleep, stress, emotions as part of it. So let's talk a little bit about the philosophy of naturopathic medicine, because this is what defines naturopathic medicine. It's not any particular modality we use. In different states we prescribe meds and have DA numbers and do all the conventional stuff. And it's not about just using supplements, because if you replace a drug with a supplement, you're doing the same thing, basically. It's about how you apply these different modalities and possibilities to get the result you want and why you use them. So in naturopathic philosophy, we have something called the therapeutic order, and this helps identify what to do first. You start with number one, identify the conditions for health. That is basically what we talked about, getting rid of the obstacles to cure. Stimulating the healing power of nature, or the vital force, is part of the philosophy too. Homeopathy is well incorporated in naturopathic medicine, and this is something that should be done with everyone. So the vital force, or the healing power of nature, that sounds rather esoteric and odd, and vitalism, that's wrong, right? But it's really simple. It's when you cut your finger, the body heals itself. It knows what to do. That is the vital force in action. And science doesn't know exactly why we do that. Science doesn't know exactly why babies can be formed. We know about different neurotransmitters and hormones and so on, but the pattern, that's still a little bit mysterious. And so we use ideas like the healing power of nature, the vital force, to talk about that. The fact we don't know exactly what it is, we can see it and we can do stuff about it. And then the third thing is to address and weaken organ systems. Support the body in different aspects of it. Support the digestive tract or detoxification or whatever system is having problems, so the entire body can heal itself. And when these three steps are not enough, then we go on to correcting structural integrity. This is chiropractic or osteopathic. Try to address the pathology, change pathology directly with natural substances, herbs, and so on. Then there's a time for medications after those fail. And finally, there's a time for suppression or surgery, even. There's nothing necessarily better about any particular modality, except you'd rather not do surgery if you need extra sleep. Yeah. So there's a time to implement these things. And that's what the philosophy helps us guide, how to do the least harm and the most benefit. So what I do is I deal with the biochemistry and the physical body primarily in this setting. I do a lot of specialty testing, organic acids, food intolerance testing. Certain kinds of food intolerances are not tested in conventional systems, and so you need to test them outside of the conventional system. I focus on gastrointestinal health greatly. I think the GI system is frequently compromised in children with developmental problems, and when there's inflammation or problems in the gut, not only can't you get the nutrients you need, but you're driving the entire immune system and leading to just lots of problems. When your stomach hurts, it's hard to think about much else, really. Sometimes work with immune system balance, and then detoxification can be part of it. And you know, detoxification is very popular these days, and we hear a lot about it. And this is one of the more dangerous things that happens in alternative medicine, and particularly with kids these days. So my philosophy of detoxification is going back to the therapeutic order. It's supporting organ system function so the body can deal with it itself. I'm not a big proponent of EDTA chelation or DMSA chelation. These are strong medications that can cause problems. Maybe they're necessary in some cases, but in general, supporting the body itself can allow this to happen, and it may be more slowly, but yeah, I don't think it is good to chelate most kids. And there's a lot of other ways to do this. Yeah, so specialty testing, allergy testing, these are primarily blood and urine tests that I do. GI testing is stool. That's always fun to explain to parents how to do that, send it off. Sometimes look for infections, GI function, maybe genetic testing, hormones can all be part of it. And so I don't do this with everybody. These are just possibilities, and that's what we do with intake and history, is figuring out which systems need to be looked at and where the blocks are in the person. And nutrition is core. So I teach nutrition in at the university in Portland, Oregon. Nutrition, I think, is so important. And nutrition to me is not supplements. Supplements are helpful, but nutrition is food, right? And part of this is removing allergens and eating foods that are not irritating, and part of it is adding appropriate foods. Now, this is a hard sell for many kids, eating vegetables and so on. Sometimes supplements are necessary, or sometimes you have to be creative and do smoothies and tasty soups and hide stuff in there, you know, or there's recipes to hide tons of vegetables and meatloaf, you know, whatever. Yep. So in diets, a diet is another place for individualization. There are so many diets out there if you look on the internet. And I don't think there's any right one for everyone. And where I think of it is there's a right diet for a particular person. There's a best diet for every individual. But we have to find that. And that sometimes takes time, and that changes over life stages and situations. However, there's some generic things we can say, right? Sugar, probably a problem. I think we used to think sugar caused ADHD. I don't think we think that anymore. Sugar certainly exacerbates ADHD, though. Yeah, but you give sugar to any kid, they don't have it a lot, they'll be running around. But more so than sugar, I think, is we're talking about artificial ingredients and flavorings and colorings. The data is pretty clear these days. You give these substances in even doses that are approved by the regulatory agencies to a normal person, they're going to have attention problems. So eating the brightly colored food is a problem. So cutting that out is, of course, important. Whole organic foods is always good, and avoiding processed foods. Yeah. So generically, whole organic foods, cutting out the sugar and the bright candy, and red Kool-Aid is probably the worst food out there for ADHD kids. Okay. Another thing to think about is oxidative stress. That happens with children that are challenged. It happens because of what's going on biochemically and socially too. When you're going every day to a place that is problematic, you're going to have oxidative stress, and that's going to affect your emotions and your entire biochemistry. So this is something to think about. Nutrition can help address this, and certain people are predisposed to have more problems with oxidative stress, and this is one reason why we do testing to figure out if we need to intervene more in this area. But the distillation of this is whole foods, brightly colored foods is a great idea. And different colored vegetables and fruits have different antioxidants in them. And we need a variety of them. And so another generic takeaway is eat a rainbow every meal, right? That's a good catchphrase. And so if you have a plate with many colors on it, you can get the kid to eat it, that's an excellent intervention. So immune system balance is something I think about a lot too. Autistic people frequently have some degree of autoimmunity. That can be part of it. And so it gets tricky when you're working with supplementation and herbs. You can exacerbate these kids to make the behavior worse, doing things that work for other people. Echinacea or different ways to stimulate the immune system can lead to problems, and so this is something we need to think about. Basics goes back to GI health. So immune system is at the interface of your body and the outside world, right? Our skin is pretty much a barrier, but the mucous membranes are kind of permeable, right? So we have a lot of immune system in our nose, as we know when we have allergies, our mouth, and so on. And so those are our mucous membranes. And if you look at the inside of the digestive tract, it looks like the inside of your cheek, basically, all the way through. So this is 30 feet of immune system. And so when we have inflammation in the GI tract, we are stimulating the immune system in a problematic way. And this is one reason why the gastrointestinal tract is so important to address when we're dealing with anything that has inflammation or immune system imbalance. And so this is something that nearly always think about. Because food intolerance is more and more common, this is happening with more and more kids. Because there can be infections, because there's often stress in the younger life and developmental problems, this is often need to think about. And again, stress, psychosocial stress, will play into this as well. There's a mind-emotional gut connection, and when you're going in a stressful environment every day and not maybe succeeding as well as you think you should, it can affect your gut. Nervous system is another system that can be very important. Amino acid supplementation, like Jacob was talking about, can be very helpful for this. Other things like herbs and stress reduction is important. And stress reduction is for the kiddo, and stress reduction is for maybe everyone in the family. And this is able to address this as well by looking at the more detailed testing, like the organic acids, functional panels will help us understand how the nervous system is working better so we can specifically intervene appropriately. And again, I mentioned the detoxification. This is important for many people. Most people, we're exposed to all kinds of crazy chemicals these days. And not only us, but our parents and our grandparents were. And we're learning there are multi-generational effects for these exposures that we are dealing with now. And so detoxification and supporting the systems of detoxification is important for most people. And it's something that will help everything else move forward. And like I said, the DMSA and EDTA are last resorts, not something I do frequently for the first time. There's many other things to do. Gastrointestinal healing, very important. The gut can take a while to heal, but we can see good improvement as in 12 to 18 months to really get it under control when there's deep inflammation and food intolerance. But we can see improvement right away. When we change the diet appropriately, when we can decrease gastrointestinal inflammation, it can happen, and we see improvements immediately. So here's a slide about gut and psychology and how this affects. Schizophrenia and bipolar, this is interesting too. We have studies that first schizophrenic episodes are associated with high levels of IgG, which is the intolerance antibody in the spinal fluids. And so food intolerance happens and affects so many systems, and it's very important. We're seeing more of it. 30 years ago, food intolerance was celiac, right? It was people with food intolerance, they died young, or skinny, bloody poop, really clear, distinct things. And now it's on a spectrum where people can have very few symptoms and still have inflammation and still have problems. And when they address that inflammation and the food intolerance, it can improve. And the other thing I'd like to say, since we're talking about food intolerance, is this is not, most of these can be healed. Unlike celiac or anaphylactic, like peanut allergies, throat clothes, these usually don't reverse. When we have IgG-based or intolerance food reactions, we can reverse them if we approach it appropriately. So this is another reason it's important to look at this stuff, because we can actually heal it and get it better. So that's my basic approach and some of the things I think about. So we have a couple cases to talk about quickly, briefly. So.
Yeah, I guess that's one of mine. Okay, so actually with these, there was a family, there was 2 ADD kids in the family. This was about 15 years ago. Both I treated with different remedies. One of them was stramonium, as mentions here. About 2-3 months later, their special ed teacher comes into the clinic and actually wants to know what it is I did, because the kids did not need to be in special ed anymore. Okay, this is not what always happens, but this happens fairly commonly, where you give a homeopathic remedy and all of a sudden there's a shift and they start progressing and they just improve. And of course you got to support them in all other ways, nutrition, they may need reflex work. But something's unblocked and they do better. That's this? No? That way?
Yep.
Okay. Who's this one?
That's testimony for you.
Do we read it?
Okay.
I took my son for a homeopathic consult with Dr. Mum, and I was impressed by his ability to really listen to my son's concerns and the amount of time he took with us, about 3 hours for the initial visit. My son felt very relaxed and affirmed by Dr. Merman's unconditional listening. I was also impressed by the way Dr. Merman kept inputting data into his computer as the 3 of us discussed all manner of concerns we had about my son and his learning disability from small to large. When Dr. Merman finally identified the homeopathic remedy my son would take, it just felt right. And my son confirmed that he had always had a craving for this mineral.
That's your kid, right?
Okay. This one is mine. 11-year-old male with autism and Asperger's diagnosis, both of them. He had breathing difficulties, toe walking, high anxiety, poor sleep patterns, information processing lags, low muscle tone, constipation, hand flapping, head banging, and other self-stunning behaviors, obsessive, hypersensitivity to correction, emotional dysregulation, and no friendships. So the intervention was the reflex work. So over a 2-year period,
No?
over a 2-year period, he received biweekly treatments with neurostructural reflex integration, including, and that's just a list of all the reflexes that I did. So things like for the toe walking, shock absorption in the feet, for the emotional behaviors, hand supporting, the hypersensitivity would be moral reflex, the information processing lag would be ATNR reflex, which is like that, and then sequential arms opening for emotional opening, fear paralysis for his sleep patterns. And so, different reflexes relate to different conditions. And then the outcome was the sleep resolved, the constipation resolved, the toe walking resolved over a 6-month period, but returned when the therapy was interrupted for 8 months. He became more relaxed, greater self-confidence. He handled transitions with greater ease. The hand flapping ceased, better emotional self-regulation, and has developed strong friendships. He did come back after that 8-month lag, and he is now in, I think he's in 9th grade now, but he's just doing phenomenal and has friendships and everything. He doesn't see me anymore. So...
Thanks, Suzanne. Just wanted to let you know that ever since we started seeing you, I have such improvement with my son's behavior, academics, and overall being. His sleep has improved and his confidence has gone through the roof. Unfortunately, when we were unable to see you for 3 sessions due to schedules, I did see increased agitation, frustration, unable to concentrate, disrupted sleep patterns, joggled speech patterns, and bedwetting. You're a miracle worker in my eyes, and I so appreciate all of your help. I was feeling so lost. My son was struggling, losing confidence, and in need of help. We are so grateful to you and appreciate all your work with us. Thanks so much. So this is one of my cases. This was a 7-year-old little guy, came in, he was having trouble concentrating. He had poor digestion, definitely a picky eater, all kinds of mood issues, and they were starting to go down the ADHD road. teacher was talking about how that it was looking like it needed to happen and get a medical consult, and they saw me before they did the medication trial. So we did pretty straightforward stuff. Initial allergy testing, removed, or intolerance testing, removed the major allergens and intolerances, started a whole foods diet, did some basic supplements like fish oil, multivitamin, probiotics. And at 3-month follow-up, mood was improved, problems had resolved in school, happier home life. And then about the 3 months is where we start doing reintroduction. And when they started doing reintroduction to foods, they noted definite mood and behavior changes through reintroducing some foods. So more work was needed there, but he was doing much better.
You want to read it?
Who is this one?
It's a testimony of Dr.
I sought Dr. Leach's help with a long-term health issue earlier this year. He was attentive, an excellent listener, and thoughtful in his responses and suggestions. With Dr. Leach's help, I've been able to make significant, measurable changes in my overall health and well-being. I feel confident in his care, and I have already recommended him to a number of my friends and acquaintances.
So hyperactivity, this is a 2 3/4-year-old young male with autism spectrum disorder. Hyperactivity, biting. When he first came to me, he was biting children in the preschool. He was rough with the other children, rough with animals. He had stool retention, toe walking phobias, emotional dysregulation, disorganized sensory processing, including tactile defensiveness, and poor sleep patterns. His initial evaluation with me, I didn't know how I was going to get through it, because this little guy, and he was like a rubber band, against all the walls, and he screamed the whole time. And then at the end of the evaluation, he got up and said, "Can we do it again?" It was really funny. So the duration of treatment was 2 years. I did core tendon guard reflex, which is the core fight-flight schema. Foot tendon guard, which is part of that fear paralysis. Abdominal, which is for sleep. It's abdominal sleep posture. Reflex, bonding reflex. Spinal gallant, spinal press for his hyperactivity, and sucking reflexes he had, with the biting and so on. And the outcome was he became calmer, less fearful, more cooperative, lower sound sensitivity, cessation of biting, cessation of drooling, greater speech articulation. He became potty trained very quickly, better transitions, and less oppositional behaviors. And like within 6 months, he'd stay on the table, and I could do anything with him. So.
This is one of mine. This was a 3-year-old Russian kid. At 3 years, not speaking, digestion is poor, he's not growing well, so the pediatrician is quite concerned. So they brought him in. And this case really illustrates how we find the remedies. So it was difficult. I was going back and forth trying to get the whole story. And the most striking thing about him is he was eating cucumbers all the time. And why would that even matter as far as his other health issues? But that's what actually guided me to this remedy, antimonium crudum. We started him, this was not a single dose application, but a daily dose, and fairly slowly, digestion improved. He started, his stool became normal, he perked up, he started growing fairly fast, he started speaking fairly quickly, and just right now, he's probably about 6 now, doing very well. He's had a couple other remedies. We still need to treat, he's not done yet, but doing quite well. Oh, that was another one here. This is an interesting one. This case was actually a supplement case that we did, the neurotransmitter supplements. An adopted girl from Guatemala, ADD and oppositional, and initially no response because sometimes it takes a while to get the supplement dose, but once we figured out the dose, it clicked and she was doing so much better. She's better in school, everything's good. and became Miss Minnesota, a couple of years ago. And this is actually the case where I keep telling mom, let's do homeopathy to actually cure this, because we're still doing neurotransmitter supplements. And she's just so happy how good she is, she doesn't want to do homeopathy. Okay.
So this is one of my cases. Little guy had a sudden onset of tics. Right-sided head tick, side of his body. That's scary. Everything was ruled out, and there's a family history of Lyme disease, and he tested positive for Lyme as well. So it's probably hard to tell where he got it. It could have been from his mom, however. And so he started seeing multiple providers. One of them was me. He was doing antibiotics and some other herbs, and so 3 months into that, the tics, they were better, but they weren't entirely gone. And then that's what we did, just another food test. And when we removed the allergens there, that's when things really started to improve. And then after 12 months, the ticks were entirely gone. And so this was a kid with very poor muscle tone, not doing well, didn't have good interactions, and at this point, it's been a couple years later, he's playing hockey, doing well in school, like smart little guy. So it's pretty great to see that.
Oh, PTSD, the reflex work, we have a whole protocol for PTSD. And the UN is looking at including our PTSD protocol as part of the first responder protocol for international, traumatic events. So this was an 8-year-old female with a diagnosis of PTSD from repeated strangulations from an adoptive brother when she was an infant. Her sleep was interrupted 2 to 3. At this point, when she came to see me, her sleep was interrupted 2 or 3 times nightly. She couldn't sleep. She ate less than her little baby sister. She had a nervous stomach, poor eye contact, low facial affect. She was pale and fearful, extreme timidity, social withdrawal. She kind of presented like a selective mute. So I was giving a presentation like this evening, and the mom came up to me and I just showed her a couple things, foot tendon guard and embrace and squeeze. And she went home and then she phoned me and said it made such a difference, she'd like to come in. So she came in and I did those things, embracing squeeze, which is from the tactile therapy, bonding reflex, fear paralysis, foot tendon guard, tactile, neurostructural. And 3 days later the child was eating, her laughter returned, her sense of humor returned, she slept through the night, she started expressing language. And then she saw me again a week later. She had normal facial affect, healthy skin color, expressive eyes. Her fears were resolved, where she went from where she would not leave her mother's side. She couldn't look up. There was no eye contact with anyone else but her mother. And she went from that to, she walked into the garage at home without even realizing that she'd done it, and there was no fear. You can just go up. Okay. Yeah, and she appeared happy and normal. So that was after 3 treatments, which again, it doesn't happen, it's not going to happen every time. It can happen like that. Because, she just had that one, interference from the infant situation, which the fear paralysis reflex resolved.
Well, so these are grade 18. That's us. So, any questions? Or?
We should probably turn on the lights and.
I don't think we need the lights on.
No? Okay.
It's a bit bright with lights.
You move a little bit that way, so.
We can, Okay. Go ahead, PJ. Oh, Connie, go ahead, Connie.
How are you doing? My question is, so you guys are all going to be working here, and so say if I was to refer someone here, do you accept insurance? How does the insurance thing work? And 2, then would you refer to one of you in particular, or you refer to the group, or in working with the group, how does this work?
Okay, so the intake is we'd all see them at once. We do the group intake, and then we would present a plan to them, what we think should be done, and then it would be up to them to choose which way we go. But that's one of the things about this group is we'd all be there for the intake, and then insurance varies between us. So
and currently the intake is free, by the way.
Yes,
It's a free
yes.
initiative.
And it's better to integrate all these therapies because they address different parts of the individual. So we're thinking that it's going to create a lot better effect if done together.
Mm-hmm. And so some of the therapies will be covered by insurance and some of them will not?
Yep.
It depends. For example, the stuff that I do, if we're doing neurotransmitter supplements with me, then the visits might be covered if you're because they are fairly short visits, so it's easy to run it under insurance if you have the plan. Homeopathy is different because it takes so long. No insurance is going to cover that, so that's going to be cash. Supplements themselves, on the other hand, are not covered and may run for a kid probably anywhere from $75 to $200 a month, depending. That's for these specific supplements. Homeopathic remedies are free and included with the visits, and you can address what.
Yeah, I'm on a network for most plans, so they can get reimbursed with their out-of-network rate. Health savings and flex spending plans can all be used, and those can also be used for any supplements I might prescribe as well.
And the same with me as well. I
Yeah.
forgot that one.
And mine is, I'm not covered by insurance, although the house savings